If you use a computer, you could be at risk for carpal tunnel syndrome. It's time the treatment has evolved. Avoid surgery and pain. Discover the miracle that is the Miracle Splint.
The Miracle Splint is unlike any other. Traditional splints feature rigid, uncomfortable metal bars. I designed the Miracle Splint incorporating a medical-grade, flexible support so it can be custom molded to your hand, making it more comfortable and medically more effective in reducing pain and inflammation while promoting healing.
Simply heat the Miracle Splint in the microwave, slip in your hand, snug the straps, and allow it to custom mold perfectly to your hand. And for arthritis sufferers, the soft and flexible fabric will ease your pain by allowing you to wear the Miracle Splint all day or all night. It's truly a miracle.
Easy use guide for the Miracle Splint Pro. Remove the plastic bag and take the Miracle Splint Pro out of the storage pouch. Remove the brochure and instructions. Open the 3 Velcro straps. Remove the large night finger resting piece D and the 2 plastic bags containing the dynamic hinge and dynamic traction. Store the plastic bags in the pouch since many patients do not require these components. Open the large bottom flap and remove the orthoplast pieces B and C, which are needed only for rigid support. Close the Velcro flap after removal. Microwave your Miracle Splint Pro for 60 seconds on high. Sometimes the plastic loops can become hot. Use caution. Put on your Miracle Splint Pro, tighten the Velcro straps, and place your hand, palm down, on a flat surface, resting your fingers for 60 seconds, allowing the device to custom mold to you. Using the night resting piece or T-piece. The night resting piece or T-piece comes with the splint and is for patients with arthritis, tendinitis, inflammation, and aches in the fingers. It is used to allow the fingers to rest comfortably, usually at night, but can be used during the day as well. Open flap A by the thumb hole and remove orthoplast piece A. Insert piece D all the way in. Secure and attach piece D with the outside Velcro flap. Slide in hand, resting fingers on the T-piece, and tighten the straps. For a more customized fitting, you or your therapist may microwave and mold as desired. The additional finger support strap may be used if desired. Removing the night resting piece. Undo the Velcro straps. Detach the flap on the back of the splint and slide out piece D, the night resting piece. Insert piece A and fasten the flap. We recommend consulting with your therapist or doctor for proper alignment and use of the dynamic hinge and dynamic traction components demonstrated next. Using the dynamic hinge. The dynamic hinge is pre-adjusted to allow 45 degrees of flexion and extension. If desired, or instructed by a therapist, use the included Allen wrench to further adjust the dynamic hinge's range of motion. Insert the long end of the hinge into the opening in the Velcro with the dark screws facing out, and attach the Velcro on the hinge to the splint. Put on the splint and fasten the Velcro straps over top of the dynamic hinge. Using the dynamic traction. Remove the hook piece and dynamic traction components from the plastic bag and lay them out on a table along with the T-piece. Velcro the dynamic traction components to the T-piece along the front edge. Attach the 4 rubber bands to the hook piece and slip the cap onto the end of the T-piece. Applying dynamic traction to your patient. Apply the Miracle Splint Pro to the patient. Remove the hook piece, maintaining connection to the rubber bands. Slide the T-piece between the Velcro straps as far in as it will go and reattach the hook piece to the end of the T-piece. Slip the slings over the fingers and institute dynamic traction. Additional view of the dynamic traction. Thank you for taking the time to learn about the Miracle Splint Pro. We hope the video and our little miracle are helpful to you in your healing. If you have any questions, please feel free to contact us either by phone or email.